All right, well, there we go. Well, hello, everyone, and welcome to our April Building Bridges meeting. We are so excited to be here again with you all for another PFA Network event, and today a Building Bridges event for the month. So we are super excited to have some really great discussion today, but we are going to dive right in, and I want to make sure that I cover a couple of these housekeeping items before we dive into the content. So on our next slide, just a couple reminders about Zoom features. So again, double check that you can find your Zoom toolbar, lots of features there. And especially important, on the next couple of slides, I am going to remind everyone that we are recording this meeting. There is a transcript that is available. And then also we want to make sure that everyone is selecting your preferred language. So we do have Spanish interpretation on. And so that means we need everyone to go to that little globe icon and then click on your preferred language. And on the next slide, breaks it down just a little bit more. So if you can make sure for everyone on the call, if you wouldn't mind going to click the globe with the interpretation button and then selecting your preferred language. And then you can also select the mute original audio if need be, if you are going to be utilizing Spanish interpretation. So I'll give everyone again just a few moments to do that. I'll leave the slide up to make sure that everyone is able to see. All right. Okay, I think we are in good shape. We will share this reminder as other folks will likely be joining us, but we will go ahead and move forward. Okay, so just a reminder about our agreements within the PFA network, and we generally will go over these at the start of all of our PFA network meetings and events, just to remind everyone about kind of how we are together, how we show up together for our community events. So one that we want to raise up today and that we've just been making a quick reminder to share with everyone is the last one you can see is that if you are using programs like Read AI or any sort of program for AI notes, we understand that this is a helpful setting and a lot of folks utilize and need this. We just want to ask that you would double check your settings to make sure that the notes are not being widely shared or spread after some of these programs will, after you close the meeting, immediately send out notes and things like that to every person on the call. So we just want to make sure that we just ask that you would respect everyone's privacy. We often have a lot of sensitive conversations and personal things shared during these types of meetings. And so just want to have everyone check in about that. And just, again, that respect for privacy. All right. Oh, okay. Karen, were you saying something?
Not me. No.
Okay. I saw like your box light up. So I was like, oh, let me double check. Okay.
Oh, really?
Yep. Okay. All right. Well, let's move forward and move into our introduction. So I have a couple of questions here, and we have a good group on right now and others joining. So I'm going to ask if you wouldn't mind putting these responses into chat. So if you could chat in your name and your location, where you're calling in from. And then also our question today is, imagine a PFA network welcome mat. So what would it say to make someone feel included? So let's get those visual brain cells working and think about that. Would love for you all to think about it and chat it in, and that will be our we'll use that by way of introductions for today. So again, imagine a PFA network welcome mat. What would it say to make someone feel included? All right, and let me open chat really quickly. All right, I'm seeing a couple coming in. Your input matters. Your stories welcome. So wonderful. Yes. So keep those thoughts coming, thinking about, again, a PFA network. Welcome, Matt. And what would it say to make someone feel included? Because that's all about what we're all what we're doing and what Building Bridges is all about. A few more here. When you're here, your family, and then let's learn together. So wonderful. Love all of these. Please continue to think about them and keep them coming. And I see one more here. Rose, you are important and valued. Life experiences matter. So wonderful. Well, thank you all. Please keep your ideas and thoughts coming. And I am going to move us forward. All right, there we go. So again, today we are here for our Building Bridges event. And a quick reminder about Building Bridges. So this series is all about creating a sense of belonging within our PFA network community. So we've had a few so far. The last couple that we've had are we've talked about and heard from members of the disability community, and then the LGBTQ plus community. And today we will be hearing from and talking about the Medicare and Medicaid community and those who are receiving services from those two health systems. So we are looking forward to diving in. We'll have a little bit of a question and answer interview panel type of discussion, and then we will dive into open discussion. So we really also want to make sure that we're able to hear from all of you on the call and have a really rich discussion. So that's what we'll be diving into here today. All right. So I am going to move us right on in, and I want to double check. I don't see Kathleen on, but I see Laura here with us, and we are so grateful to have you on with us today, Laura. So I'm going to pause for a minute and let you give your introduction first, and then we'll start off with our questions. So Laura, I'll turn it to you.
Hi, Brittany. Thanks. Hi, my name is Laura Carroll. I am a patient, family partner, and paperwork slave to a duly eligible person, my husband. Um, it's really about all the story you have to know if you've been at this dual eligibility game a while, right? Super glad to be here today and kind of open this conversation. I think folks who fall under this dual eligibility umbrella, we encompass so many other areas that are so important to talk about in this patient and community experiences that we have. Generally, all of us who are dually eligible are also medically complex and or socially complex and things of that nature. It's a really deep well and a very interesting one to talk about. And I'm really excited to hear what other people's experiences are, how you came to find out about dual eligibility. I really want to have a conversation with other people who have been through the experience that I've been through, because frankly, I found it very confusing and complicated and not even sure if I'm even doing all of the things right. And I'm considered to be somebody who goes around as an expert talking about these things. So I'm super excited to have this environment with people like me to talk about the same situations that we have and brainstorm to make it easier for all of us. Thank you for coming, you guys.
Thank you, Laura. Wonderful. All right. Well, let's dive into our first question, Laura. So, can you share a story or experience with us where you feel like you successfully advocated for yourself or for a loved one receiving care from both Medicare and Medicaid?
Gosh, just even getting dual eligibility set up for my husband felt like a battle and a marathon and all of those things rolled into one. And really that was an act of advocacy, and anyone who's been through the experience, congratulations. It's the hardest act of advocacy I have ever done. When my husband was finally approved for his disability, and many of you who are on this call, you've been through that process too. All of a sudden we had pretty much 72 hours to figure out what we were going to do with our health insurance, which is pretty crazy. And I went to this, I went to my, and I knew there were people who were like me in a similar socioeconomic environment who were getting both Medicare and Medicaid, but I didn't know what that meant. And I knew there were people out there who were doing that. And I had 72 hours to make a decision about my services. And so I walked into my county office and I'm like, hey, I know there are these people who are on Medicare, but like Medicaid like backs it up or and I was explaining all of this to my county and I was in there for hours and they had no idea what I was talking about. And the reason they didn't know what I was talking about is because I didn't know the term dually eligible. The problem is they didn't know what dually eligible meant. So when I was describing to them what dually eligible was, they didn't know what it was, and I didn't know that's what I was talking about. But literally, it is a program, and by its nature, these dually eligible things are very confusing because they are mandated by the federal government. They are controlled by the state government. They are handed out by the county, right? At least in my state. So very confusing. I ended up just starting to talk to other people who I knew were having similar situations to even find out what dual eligibility even was to know that we were eligible for it. It's part of the reason that I think we need to get on talking to more people with lived experience in this environment, because if nothing else, there are a whole lot of people out there who probably qualify for these programs, who probably really need these programs, and don't even know they're eligible for them. And that's even worse than any of the rest of it, in my opinion.
Thank you, Laura. Yep, absolutely. It's so true that oftentimes folks just don't know. Like you said, you go in and you have a vague sense of what you're asking for, but sometimes it's hard to even put into words. And then especially if you're also kind of in a health crisis, you're also in the middle of dealing with yourself or your loved one who is feeling ill. And it's a lot. So thank you so much for sharing that. And kind of to build off of that, Laura, what programs or resources, things like that for you, did you find to be helpful as you were getting started, or just anything that you felt like was a support to you?
There were a few different things. First of all, I actually had to seek out more people like me, right? And back then that was a lot harder than it is now. So community was so terribly important. Um, for my family, and I always am afraid to say these things out loud in public spaces, for us to get the most benefit out of our dual eligibility, we ended up having to go with a Medicare Advantage plan. It was really the strongest way with our situation. As Britt knows, I have a very complex family situation, and my husband's medication, one of them is almost $15,000. I just checked the price since we talked, Britt. It's now up to $15,000, and he takes that twice a month. And if I wasn't done, and I could not do something without a really solid D out there, right? Um, but for me, that became the best way to manage that. And the other reason that that became important, as a lot of us know, there is some food as medicine type fundings out there being sent down from CMS right now. And unfortunately, it is not being managed by either CMS or by the state Medicaid organizations, right? So if you want to take advantage of those monthly food monies that are out there, for example, my family gets almost 200, I think over $200 a month now as part of our benefit through that Medicare Advantage program. That if we were doing the Medicare and the Medicaid on their own and managing it ourselves, that money would be fully left on the table. And frankly, that's wrong. And how do we fix those things? With advocacy. And where do we find more people to have that advocacy? Welcome, please join me.
Absolutely. And just to build off of that, Laura, so through your plan, you were able to figure out, this food benefit and things like that. Was that something that was shared with you? You did your own research to figure out those types of things?
We did a little of both. We're kind of lucky in rural areas in some ways. I mean, like we have 4 plans to choose from on Medicare. 4, where in cities, some people have up to like 40. So for us, the good news is we've got traditional Medicare, Medicaid, and like maybe 2 or 3 other options where we even are. But yeah, for us, it actually came to us sitting there and reading and writing stuff down on pro con charts. And actually, finally, in the end, we found an insurance broker that was local to our area who knew what we had here and helped us weed through it together. We actually went and found a broker too. I wish it could be easier. I would love to push for easier, but at this point, these seem to be the best avenues. But gosh, if there's other people who are finding better ways to get into these systems, I'd love to hear about that too. That's why we're here.
Exactly. Thank you, Laura. That is exactly why we're here. So, yes. Well, thank you, Laura, so much. I put the slides back up for these discussion questions because we want this to be an open discussion with us all. Thank you so much, Laura. And again, if anything that Laura just shared is resonating with anyone or anyone had a similar experience, please feel free to share. I know, Lori, earlier in the chat, you said same in Wisconsin. Lori, would you mind just saying a little bit more about that from your space?
Well, my kiddo is 16 and will be turning 18 in obviously 2 years. So I've started to look into the dual eligibility because it's something that is going to be our reality pretty soon. And when Laura was mentioning, like, you have the feds, then you have the state, then you have it dished out by the county. It's the same thing in Wisconsin, and it's very confusing. I have a lot of families who are doing that because I work in pediatric healthcare that are doing that transition to the adult world, and they just don't know how to, make that broker. What do we apply for? How do we apply for it? How do we know how to bring it on board? And what does it cover, right? Because there's so many things within every county manages things differently. So what's covered and what isn't covered is really the biggest concern that I hear from families. And I know when we start thinking about some of the coverage that comes in there for care, especially if they need to go to some type of a facility where they need to have their care managed, or even if our kiddos, in my case, like, I want to have my son independently live on his own, but he can't manage that by himself. So what can be covered and what can't be, and it's just super confusing, and I haven't really taken the deep dive yet, but I just know what I've been hearing. So, and Rosie's in my state, so Rosie might have better ideas than I do.
Thank you, Lori. Yes, Rosie, go ahead. I see your hand up too. Perfect. Uh-oh, Rosie, you're on mute.
Laura, I was just going to say that I'm in the state of Wisconsin, and I'm on the IRIS Patient Advisory or on the IRIS Community Council, and so we do a lot of talking about that transition from pediatrics to adulthood, and the IRIS program is so supportive of that. A lot of young people are in that program, and they have the dual membership, and that's our big fear about the Medicaid going away, because and we've done a lot of writing and things because we want to make sure. But Wisconsin has a really good program. It's not the IRIS program, and there's several different avenues you can go down in the IRIS program. But and then on the Medicare and Medicaid side, the healthcare program, the healthcare insurance I have now has a patient advisory group for the Advantage program, and so I'm on that patient advisory group, and that meets quarterly, and it's really good to bring those concerns and thoughts to that group, and they're always looking for members on that committee also. So I use Network Health because it's more of a local statewide kind of program. It's not one of the big ones that covers a lot of states, but more Network Health is a state program. So
That's helpful, Rosie. Thank you.
yeah.
Wonderful. Thank you so much for sharing. Let's see, Joy, I see your hand is up as well.
Yeah, so I'm from California. See, the thing is that there's a lot of information out there, and you have to be careful that the information that you're getting for yourself or your loved one is unbiased. Because I had to do a lot of research on my own, and I went to like the National Council on Aging and the California Department of Aging, and they have a lot of information on how to break things down. Because another thing I don't like is how they're targeting seniors, because my loved one is a senior, and you guys all see all those commercials. And whether you like this form or plan or not, it's misleading, because you got to do a deep dive to find out if this particular plan works for you. But of course, on a 30-second, 1-minute commercial, they're not going to say all of the things that need to be said. And if you call that number, for example, they work for that company. So you're not going to get true, unbiased information. So I think what needs to be done is there needs to be more of a push for people to have access to the proper information. Because right now, I see a lot of push towards companies that are pushing people toward a certain plan, whatever plan that is. And people need to have that information available to make their own decision.
Thank you, Joy. Yep, Rosie, go ahead. I saw you get a jump in. Yep, go ahead.
Well, especially I agree with Joy, and not only is it on TV, but you're going to get your mail full of, especially our older adults are going to get their mail full of little cards that say you're eligible for this or you're eligible for that. And every time you fill out one of those cards, you're going to have an insurance company at your door. And basically, because that they are trying to sell their insurance to you. And so if you've already made a decision about insurance and you are happy with your insurance, don't ever fill out one of those cards, because I've made that mistake, because it sounds like I'm eligible for something that I didn't know about. And so it's like you're eligible for food, or you're eligible for this, or you're eligible for that. And so I filled out a card, and very quickly I found out that it was an insurance company that wanted to sell me their insurance. And when I said I don't want to change insurance, that they were upset with me because I was wasting their time, they told me. And I mean, I literally was told that by the woman that showed up at my door. You're wasting my time. And she said, don't ever fill out one of those cards if you're not going to want to change insurance. So basically, she probably gave me good advice, but she didn't do it nicely. And so basically, because she was just selling her insurance, and that's what she wanted to do.
Wow. Thank you for sharing that experience, Rosie. I'm sorry that it was tough and not said in the most graceful way, but also for sharing that tidbit with the rest of us that sometimes you got to be careful with what you're filling out and giving your information to. But like Joy said, in California and for all of us all over the place, there's so much, and it's sometimes difficult to know what is reliable and what isn't, and should I be filling this out, because you also don't want to miss a deadline or miss something. And so it does take a lot of that extra research and deep diving. And so yeah, thank you for sharing those experiences. And that goes a little bit with the first bullet question here too, for anyone what advice would you give to someone who may be just getting started trying to figure out navigating both Medicare and Medicaid? So any tips, tidbits? We've heard a little bit about making sure that you're deep diving. I think that's kind of a theme of the day and doing a lot of research, but any other advice or tips that you can think of that you would offer by way of advice for anyone just getting started?
Brittany,
Yes.
I'm unable to raise my hand on this
Oh, it's
device
okay.
I'm on.
Hey, Elena. Yep, go
Hi.
ahead.
My thing is, and one of the ladies kind of briefly touched on it, it's important to find an insurance broker as opposed to a particular ad or company. The broker that we've worked with for years, he represents probably, I think it's about 40, maybe 50 companies. So it makes it a lot easier to get information about what you need as opposed to which company. And for us this year, when we had, or coming up for this year for the Medicare even, he gave us like 4 or 5 options. And so that's how he looks at it. And he lets you know in advance that he does get compensated from him. But like I said, it's not just one individual company. And if you start early enough and find one that is well connected, they really do their homework.
That is so helpful, Elena. Thank you for sharing that. That's a great piece of advice. I see lots of heads nodding, saying the same, saying yes. So thank you for sharing that, Elena. Hey, Nancy, I see your hand raised. Go ahead and jump in.
I'm sorry, I just joined in.
It's
I'm still in
okay.
the hospital and it was kind of crazy here for a minute ago. But
No problem.
I'm not sure if anybody's, spoke about this. Is we're in the process of starting Medicare and Medicaid being dual with my daughter, but she also has the waiver as well, consolidated waiver. And even though she has all three, there are still some things that she can no longer get because Medicare is her primary. And so, right now, like just today, one of her machines that she's supposed to get, because it doesn't come with some kind of code that Medicare needs, they will no longer provide a respiratory machine that she needs to stay alive with. They will no longer provide it. So now we're in search of a machine that does the same thing that they will accept.
Wow.
So when you're switching over, or when they switch you over, you have to make sure that you're comparing apples to apples with all the things that you need. Because make a list and make sure that whomever, they will pay for whatever medications, machinery, doctors, and everything. I don't care what it is, especially when you're doing it for your loved one, whatever they need, from diapers to chucks to whatever. Every item, itemize it, go through the list, sit with your person, and make sure that every single item is on that list, because and it needs a code and it needs all this, because that's the only way Medicare will pay for.
Wow, Nancy, thank you for sharing that. That is also incredibly helpful, especially that code piece. I know it in the grand scheme of things, when you're going through everything else, the last thing you're kind of thinking about are codes for everything. But like you said, it's very important to make sure that what you need is indeed covered. So that is a really wonderful and helpful piece of advice, Nancy. Thank you. All right, I'm seeing if anyone else had thoughts on pieces of advice. Another question we have is, how can we as a community better support family caregivers who are navigating both Medicare and Medicaid for loved ones? So I think a lot of us have been in caregiving positions. I know I have personally, and it's not easy. So any thoughts on how we can better support family caregivers, or those who have been or are family caregivers? Are there certain things that have been useful or helpful to you? We'd love to hear. Hey, Naomi, feel free to come off mute.
Hi, everyone. I appreciate this conversation so much. My son is almost 16 and will be navigating the the wonderful transition. I'm laughing to keep from crying um in a few years. But I would say in having these conversations, continuing, to have these conversations and making these connections are extremely helpful, especially for those who have already, traveled the path and can help those that are coming behind you know what pitfalls to avoid, what questions to ask. I don't know I don't know what I don't know. And, having the capacity to learn one more thing is a lot. So I am very grateful for this conversation and knowing kind of who I might be able to reach out to as when the time comes to dive into that part of transition, if it's still here.
Thank you, Naomi. Absolutely.
Brittany?
Elena, yep, go
Yes.
ahead.
For caregiver support, it's important if you can connect with, in California, we have caregiver resource centers that have a lot of this information. The one in Southern California, you even get your own navigator, or they call them now family consultants, who, if they can't answer it for you, they will connect with their colleagues. And if you don't have that in your state, there's also, of course, again, California calls it regional centers. But as caregivers, we have to sort of seek out those programs that are supportive, that you are the client, not your loved one. And so that their interest is getting you connected. And in every state, and here again, they call it Center for Healthcare Rights, which talks about, or they troubleshoot Medicare and Medicaid situations. On the back of the Medicare book that we all kind of toss to the side every year, it lists the name and the number for the the same organization in each state, because like I said, it's a different name, but they are really helpful. And even though a lot of you have children who are not seniors yet, you're contacting senior centers in the different states. They often have a person who kind of looks out for these resources.
That is very helpful, Elena. Thank you so much for sharing those tips. And that's great what you shared about as a caregiver. One of the programs that you mentioned is just for the caregiver. So that's a great resource. Thank you for sharing that. Hey, Pat, go ahead. Uh-oh, Pat, you're on mute.
There we go.
There we go.
Yeah, thank you, Brittany, so much. I'm also thrilled that you're having this conversation. So I'm from New Jersey, and my son is 35 years old with severe cerebral palsy, and most of his care is outpatient based, and we manage the care with help from other programs at home. And what I found after I retired, he left my insurance. He was eligible for my insurance for his lifetime as long as I worked. And then when I retired, we then went into the Medicare, and he already had Medicaid. And Medicaid pays for his program that he attends. So that's wonderful. But other than that, Medicare has been great for us. But Medicaid, not one of his adult team physicians take Medicaid in our state. And I find that that's something families in New Jersey talk a lot about. They can't continue to get the great care. They've got to find someone who may not be at that level of expertise to settle with because they don't take Medicaid. And I think it's real important, like you talk about support, or I don't know, advocacy to me is a better word at my age. Like I'm pretty independent. You don't have to feel sorry for me anymore. I got the whole routine down. But advocating to our legislators about the importance of not cutting Medicaid and increasing the amount of reimbursement and making it more appealing for people to actually accept it.
Thank you, Pat. Very helpful. And thank you so much for sharing.
Hi, this is Bobby Reed. I was sitting here trying to
Bobby.
figure out how to raise my hand. I can't figure it out on here.
No
but
worries. Go ahead, Bobby.
I have a comment to make. if you have an affiliation to a particular disease, for example, my son has chronic kidney disease and is a transplant recipient, so kidneys, right? If you go to that, they have professional organizations, like there are a lot of kidney organizations, but one in particular, the American Association of Kidney Patients, maintains a list of support groups across the entire country. Every like 6 or 7 months, I get a request to maybe look into my area because I'm an ambassador for them to update them with contacts and information. So people may find that to be a resource for them to garner information. So, and I believe that every organization related to kidneys, if you called them and asked them a question, they have resources where they can connect you locally to find the answers that you're searching for. And I'm sure other organizations do the exact same thing. So you might want to look to that as well. The other point that I wanted to make is when you're a caregiver for someone, I think it's vitally important that when they go to their doctors, or you go with them, whatever, that you ensure that you are listed as a person who's eligible to discuss their medical information or whatever with whomever. Have them sign a release form. One release form does not blanket everybody. Every particular office or doctor uses their own. And a lot of people are under that misconception, oh, I have it signed up here, I'm good to go everywhere. And that is not the case. So that's something that you need to keep in mind. And something that I stress all the time as a caregiver is when I go to the doctors or there is a doctor's report, I believe that your primary care doctor is the guy that steers the ship. He's in charge of everything. And I request that a report of that visit go back to, or that doctor contact the primary care doctor to keep all the records in a centralized file so that he's aware of what's going on with my son's total care or even my total care. And a lot of times I meet with reluctance from these doctors saying, oh, they can just look it up on the system or whatever. Well, that's not necessarily the case because all those systems don't talk to one another, and the doctors don't have access and they have no idea, and they just have blinders on. And I feel that communications is a really important thing. So those were important points that I wanted to bring up, not only for the care of the patient, but also for the caregiver situation. Thank you.
Bobby. Yes, thank you so much for jumping in there, and very helpful. As you said, if you're able to target or look at a disease specific area where there are supports for that area, as you mentioned, for instance, chronic kidney disease. So Bobby, thank you so much for sharing that. Rosie, go ahead.
The other resource that especially is helpful is the ombudsman for your area. And there's an ombudsman for, long-term care. And there's also an ombudsman for these kind of programs. And every state has them, and they're required to have them by law. And so, some states are better than others, but the ombudsman is responsible for making sure that not only that the person's care is taken care of and they're safe and they're, and they also making sure that the family members who are caring for them are not being overextended, because many times I go to a conference called Self-Determination here in the state of Wisconsin, and that conference, it's always interesting to me to see, like the woman said, 35 to 40 to 50-year-old people and 60-year-old people whose parents are still caring for them as their caregivers, and they're 80 in their 80s, and they're at this conference looking for, resources to make sure that when they can no longer care for their child, who's going to help care for it. And that's, like in our state, and most states have them. It's a program, like the Irish program. It helps them stay in their homes rather than, I have several cerebral palsy friends who have severe cerebral palsy, who live alone, who get care, either 24-hour care from outside their families, or they get care like a couple hours in the morning and then, at night. And many of these patients have to be Hoyered, and they're not, they communicate through their cell phones. They speak through their cell phones. I do presentations with a young lady who speaks through her cell phone. And so she and I talk about this, and we share how we, I manage it as a senior, and how she manages it as a young adult. So she's 38, and so and she's been on the program for many years, and so I talk about the fact of becoming disabled at my age, and her dealing with disability her whole life. So and so we share, and we usually use a moderator, and we preset the questions and that are going to be that we ask, and she answers first because she presets her answers, and then I usually give my part of it, and so it's been, it's interesting because I do a lot of breakout sessions in my life, and the only time I've ever gotten a standing ovation was the first time that she and I presented together, and then we've been asked to present a lot of places and over the last couple months. So there is so much hope in my heart for young adults who are going into the system, because if you look at it the right way, and especially with people with disabilities going into the system of adulthood, there's so much hope for them to stay and be active adults. And I mean, most of the young people I have that I work with have gotten degrees in from universities in our state. So they went to school, they got a degree, they go to Madison to advocate for patients every year. They do more than I do for advocacy, because I'm more scared to go to Madison and go to the state capitol, but they do that every year. Some of them have done it for many, many years. So I think that, it's real important that we research what, not only go to your Department of Health and see what they have to offer, not just, not just your insurance companies, but also Department of Health, because that's where those kind of programs come through, is through the Department of Health.
That's helpful. And Rosie, a question I was going to ask you, I believe you said it was called the IRIS program. How did you find out about that program?
It's really interesting because, when I first became disabled, and my husband had to quit his job because I was so sick, and he couldn't, he couldn't care for me and also to keep his job. So, and we were really struggling financially because I was the main breadwinner and he wasn't. And so we were struggling financially. And then my sister lived in the state of Michigan, and she said, one of my friends who was also struggling found this program through the Department of Health. And so she said, but I think the state of Wisconsin also has a program like that. And so then I went to the Department of Health, and yes, they did have a program. And so, it was not hard to sign up for it. It was not, you had like 3 or 4 different options of groups that you can work with. You have a social worker that meets with you on a monthly basis or a bi-monthly basis. And then you also have a nurse that comes to your home, and you have a functional screening every year. And so basically they make sure that you're safe in your home, and that you have the best care possible. And so, basically that's, and at first my husband, because he lived in the home, was paid, he was paid for so many hours each day to take care of me. So, and it wasn't a lot of hours, but, I have 20 hours a week. and now my other family members, and I don't use any outside caregivers, but we also created a program in the state of Wisconsin where people can take this online program for free through the University of Wisconsin Green Bay, and they can take it the program for free to become a caregiver for anybody in the state of Wisconsin. So anybody that lives in their own home and needs care, you can take this online program. And if you're working already in a caregiving purpose place, so or if you're wanting to work in those kind of programs, and some people literally create their whole system of job where they go from one person to the next. But that program then gives them a $500 bonus after they complete the program, and then if they're still working in the program at 6 months, I think, or a year, they give them another $500. So that program was set up through the Department of Health, and because it was through the money that they got when COVID happened.
Mm-hmm.
But then that money is used up, but the state felt so strongly about this, and the governor put it in the budget, and so it's still happening. And so we were really, the advisory board that I'm on was really instrumental in getting this going, and wanting to make sure that people were trained better than just somebody from the community coming in and getting 1 or 2 hours of training, but really getting some really good training in caregiving and understanding what it means to be a caregiver, and how, and some even a background in empathy and how do you care. Many of the young lady I speak with has spastic cerebral palsy, and my granddaughter was one of her caregivers for several years, and she said it. I at first was really shocked when she hit me all the time, but she did, because she said nobody explained to me until her grandma did. What this, because nobody talked to her about it, and that's why the course really talks to and shares a lot about different diseases and what might happen, and how to Hoyer a patient. She went in there cold and as a senior in high school, and turning 18 and basically, but she has a really strong relationship. They have their own way of communicating with each other, and they they'll be friends for life, because they she knows, and when she sees, even now yet, if she sees that she's going to be overnight without care, that nobody's going to put her to bed, she will still go in and put her to bed, because she knows that if she doesn't get put to bed, nobody's going to she's going to be in her wheelchair all night in a wet diaper, and so she can't stand it when somebody isn't there to put her to bed. And that's the other thing that they talk about in the classes, about how important it is to make sure that when you commit to these kind of care situations, you show up. So anyway, I'm sorry I'm talking so long, but I really feel strongly about making sure that those programs are in place, and
thank you.
Yeah.
Yeah, no, that's so wonderful, Rosie. Thank you for sharing so many personal experiences and things that you've learned along the way, resources and programs that have been created, and perhaps ideas for jumping off into other states that could do something similar. So thank you, Rosie. Naomi, I see your hand is up. We'll go to you, Naomi, and then we'll start to wrap up. Our time has, it's been very meaningful. So thank you.
It goes by so fast, especially when we're having a great conversation, right? I just wanted, I had put in the chat, I wanted to clarify, and Rosie, as you were speaking, it made me think about what I think it might have been Pat, Nancy, and Lori, what each of you all said, but just in the sense of so I don't look forward to Noah becoming an adult because of how the system is. And but what you said and what the others had said really makes a difference in the sense of how the programs are. So from federal to state to local. So it really depends on how your leadership sees and feels about individuals with disabilities, right? And where the funding goes. And so what somebody else mentioned about policy and legislating, I can say where I am, we are not a disability friendly state. And it's really challenging. And the programs, I love that you all in Wisconsin have a great Department of Public Health that are very resourceful and helpful. I can say here, from my experience, they have not been. And so it's just that challenge, but knowing that there are positive things happening in these scenarios around the country is a little light to be able to come to you all and say, hey, what's happening in your state and how, what steps do you know that were taken to get these things done? So for instance, we have our waiver program. We have over 8,000 people on a waiver, on a waiting list for a waiver. And those are just the people who have applied, not those that could and should apply to be on the list. And our governor, typically in the budget, they budget for 100 new waiver slots a year, which is not much at all. And some years we've been able to, through advocacy, get it up to 500. And they really could get everyone off of this waiting list if they just increased taxes by $50 per person. But anyway, so I just wanted to clarify what respectfully I disagree, but knowing that different states do things differently, and it really does come down to how people are valued and seen, and budgets tell those stories a lot of the time.
Right. And I agree, Naomi, that other states are not like Wisconsin, and they have long waiting lists, and I hear this all the time, and it's sad because everyone should be able to have the kind of health care that they need.
Absolutely. Lori, I see your hand and I saw your comment in chat. So Naomi, connect with Lori, and Lori, go ahead.
I meet with our legislators a lot. So, but I'm looking at your last question of what is one thing that each of us on this call can do to support the unique community? And I am wondering how, as a larger community, can we think about creating a way that that our legislation works in every state the same way? I mean, wouldn't it be great if we knew in every state that X, Y, and Z is covered? Wouldn't it be great if we knew that if the federal government says X amount of dollars per person in this case, then goes to blah, blah, blah. And then, okay, maybe some services might not be in your county, right? But maybe can you go to a neighboring county and get those services? But it should not be so different. The coverage that one person has in one state shouldn't be so different in a different state where, we can get a ramp built on our house using waiver money in Wisconsin, but you can't in Illinois. That just should not be happening, because everybody is valuable and everybody needs to have access to the care and the services that they need. I mean, that's what creates equity. So that would be that's what I'm taking away from this, is how can we as this community really make a statement to those in power?
Thank you, Lori, yes, and thank you for looking at that last question. And this is for everyone to think about. And please drop into chat your thoughts and your ideas, because yes, our collective voices, we come together. My community organizing background says we come together, our voices help create the change that we want to see in the world. So thank you for sharing that, Lori. Everyone, please do put your thoughts into chat for what's one thing that you heard today. Well, based on what you heard today, what's one thing that each of us on the call can do to support this community, support each other, and again, based on all the wonderful things we heard and all the challenging things that we heard, what is one thing we can do? So Karen, I saw your hand up. I'm going to go to you, and then I have a couple more things I want to be sure to share with everybody before our time is up in just a moment. So Karen, yep, go ahead.
Yeah, thank you. I appreciated everybody's responses in Medicare and Medicaid and so forth. And we heard someone talk about Medicare Advantage, and yes, it was needed in that case. However, I believe that people, as they are deciding, and if they're looking at Medicare Advantage, find out what hospitals and what healthcare systems accept it. And here in Dallas, we've got two big systems that stopped Blue Cross and Blue Shield. They stopped Humana. So now those patients are without coverage or out of pocket. And it's hard to predict because it's changing, and Medicare is looking closely at that. But if you need a lot of care and all of a sudden your Medicare Advantage is not accepted by this major facility. And the other thing you need to look at too, because I've had this experience with my mother-in-law, is working with doctors. She has an Advantage plan. Will they accept it or not? Is this doctor a good doctor or not? That was a real challenge.
Yep.
Thank you.
Thank you, Karen. Yes, absolutely. Another really great tidbit and piece of advice to be considering. Like you said, it's hard to know and predict the future, and sometimes it can be blindsiding when things like that occur. So again, it goes back to what we talked about earlier, to doing the best due diligence research and deep dive into looking things up as we can. So, and as a community, that's one thing that I'm really noticing today, is that there are so many voices and experiences and tips and lessons learned that we can all continue to connect on and lift up and support each other. So please do make those connections. If you heard from someone, email each other, and we'll continue conversations. We'll continue to have building bridges. But I want to just make sure that if folks have questions or need to connect, there are so many ways that we can help each other. So really quickly on this slide, and this is fitting in very well with our discussion today. So if you are eligible for both Medicare and Medicaid, or the family of someone who is, there is a wonderful program called the National Consumer Scholar Program. And we wanted to share this with you because applications are open, and Lindsay put the link into chat. And so this is brought to you by a few wonderful organizations, but very specifically, Camden Coalition has been doing this work for some years, and it's a wonderful opportunity. I know a few people on the call have been consumer scholars or are very familiar, but applications are open for 2025, 2026. And so we want to make sure that we share this because it's great for those who have firsthand experience and lived experience. It's just a really wonderful program that often addresses folks with complex care needs, and you're able to come together in a community. You're able to learn and grow and connect with a lot of other folks from all over the country. So please do take a look at the information. You can reach out if you have questions, but also there in the link, if you click the link, there's lots that you can read about, and also contacts if you have more questions. So wanted to make sure that we share this. The application is open until May 31st. So we'll continue to share more information about this program. And then kind of a continuation in October, registration is also open for putting care at the center. And we at PFCC Partners are a content partner for this conference. We hope to see as many of you there as we can. We do have some time, but it is another wonderful conference that brings people together from the healthcare space as well as the patient family partner space. And it'll be a wonderful time to come together to continue to learn and grow as well. So wanted to make sure that we shared this conference with you all. There's, again, registration is open. So we will share those links as well. And then just a quick reminder about our PFA Network forum. We do have a Building Bridges space on the forums. And so it's really helpful for us all, as we talked about so many resources today and different things that have worked for folks. It would be great if we can drop those into the PFA Network forum. And so we can go back and reference or take a look. So please do utilize the forum in our newsletters and on our website. There's always a way to get there quickly. So, and let me know if you need any help. But we've been getting a lot more traction with that as well lately with folks utilizing the forum.
Brittany?
Yeah, yep.
I just want to say that you have at least 2 of us on this call, Naomi, myself, who are consumer alums.
Oh, wonderful. Okay.
And it
All right. A few. I know there are more. Rosie is, Laura.
Yeah.
So wonderful. Thank
So
you.
it's an awesome program, and I've been with them about 8 years now.
Okay.
And so
Wow.
it's something continuing, and it does open you up to advocacy.
That is really helpful to know, Elena. Thank you.
I'm super excited to be on the planning committee this year for our consumer scholars. So would love to see as many of you apply. Yeah, I'm so excited for this, Lindsay. I can't even tell you, like, we're finally covering this area where people don't get to talk about it very much. I'm really excited to be planning. I'm looking at some mentorship opportunities to share with the team that signs up. Please join us. This is only going to work if we have more people like us out there sharing this experience and learning how to share that out. So thank you, everybody.
Definitely. Thank you, Laura. Thank you for sharing that. It's perfect. And yes, we are excited to just be a part. So we'll continue to talk about the Consumer Scholars Program. And then also this is our last slide. And just a reminder to tell your friends and your loved ones and other colleagues about the PFA Network and about these meetings, because again, it's great to just bring in more voices and be able to share experiences and help each other along. So you're able again to, I'm going to stop sharing so I can see the chat. But yes, Lindsay's been very helpful with sharing and dropping everything into the chat. And then you can always go to our website, pfanetwork.org, and again, share that and spread that along. But thank you all so much. Laura, thank you for being on and sharing your experiences during the panel piece. And for all of you all, also just sharing your candid and authentic stories and experiences, always very appreciated. So thank you all. Take good care. Next month in May, we have a skills exchange. So you'll be seeing and hearing more about that as well. So we'll see you soon. Take care, everyone.
Yeah, thank you.
Thank you, everybody.
Thanks, Brittany. Thanks, everybody.
Bye, everybody.
Thank you all.
Take care.